Morning everyone, welcome to your biology class. Today we are going to start with a new topic of biology, that is health organizations. And the main objectives we are covering in this video are local health organizations and their activities regarding hygiene and sanitation, national programs introduced by our government, international organization which includes World Health Organization, main objectives of World Health Organization, activities of WHO, challenges faced by WHO for the future, Red Cross and activities of the Red Cross, and some other international organization which includes UNICEF, UNDP, FAO and ILO. So first of all, introduction. So to achieve the goal of health for all, organized efforts are being made at three different levels. These health organizations can be broadly classified into three categories based upon the level at which they work. These are local bodies, national programs and international organizations. First of all, talking about local bodies. So all municipal corporations and municipalities in the city and town area committees in towns and large villages have some department to look after the health of their people. To ascertain better health, better sanitization and to prevent the spread of diseases, these local bodies have regular staff and the needed equipment. Some of the activities of these local bodies regarding hygiene and sanitation are proper sanitation of the environment. So improper sanitation of the environment is the major cause of disease. So to maintain sanitation, disposal of sewage and domestic waste is done properly. Measures are taken to prevent pollution of air, water and soil. Next is providing pure drinking water. So a large number of diseases spread through contaminated water. Therefore, pure water is supplied to prevent diseases. Villages are unable to get pure water. Next, control of communicable diseases. So to prevent the communicable diseases, people are to be made aware of the following things. First is the ill effects of these diseases, the causes of communicable diseases, methods of spread of these diseases, preventive measures against these diseases and treatment of these diseases. So talking about school health and scheme. So children are taught about health education. It enables them to keep cleanliness among themselves and environment. To achieve the objectives of good health for people, and the local bodies have following specialized centers. First is maternity and child health center, in which mothers can get proper guidance to bring up the children from the child health centers, maternity homes and other hospitals. Family planning centers. The centers educate people about the importance of small family and use of various methods to control childbirth. Then community health education. So such education helps people to know causes, treatment and prevention of spreading disease. Nutrition education. Such education tells the importance of food for good health. Proper diet and various nutrients are necessary for a proper health. Then medical care centers. Such centers are open at different places for the treatment of diseases. Now national programs. So to prevent, control and treat communicable diseases, our government has introduced following programs. National Malaria Eradication Program NMEP for the eradication of malaria. National Filaria Control Program NFCP for the eradication of filaria. National Smallpox Eradication Program for the eradication of smallpox. Then National Leprosy Control Program for controlling leprosy. National Cholera Control Program for controlling cholera. Tuberculosis Program for controlling tuberculosis. Pulse Polio Program for the eradication of polio. Another aspect of community health is to control of these disease carriers. People are educated through media regarding the modes of spread of diseases and their control. Now, international organizations. So, health and disease have no political or geographical boundaries. Disease in any part of the world is the constant threat to other parts. In order to protect against spread of diseases from one country to the other, many organizations of the international level have been constituted. So these international organizations are working ceaselessly and tirelessly to achieve their goals. Some of these international organizations are as follows. First is World Health Organization. So World Health Organization, WHO. The World Health Organization is a specialized non-political health agency of the United Nations with headquarters at Geneva. The constitution of WHO came into force on 7th April 1948, which is celebrated every year as World Health Day. WHO had 56 members in 1948, which has grown up to 191 in 2000 AD. WHO has 6 regional offices, including one in Delhi. Each regional office service is for its member countries. Member states of WHO are bound by the international sanitary regulations to send in all relevant information about the internationally notifiable diseases. Reason and objective of WHO. Member countries of UNO focused on the need for creating an international body to look after the health problems of people of the world. With this motive, WHO came into existence. The objective of WHO is the attainment by all people of the highest possible level of health, also known as Health for All, by 2000 AD. Health, as defined in the WHO Constitution, is the state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. Activities of WHO. In support of the main objective, WHO has a wide range of functions, including the following: to act as the directing and coordinating authority on international health work, to promote technical cooperation, to assist governments upon request in strengthening health services, to furnish appropriate technical assistance and in emergencies necessary aid upon the request or acceptance of government, to promote and coordinate biomedical and health services research, to promote improved standards of teaching and training in health, medical and related professions, to establish and stimulate the establishment of international standards for biological, pharmaceutical and similar products, and to standardize diagnostic procedures. Then to foster activities in the field of mental health, especially those activities affecting the harmony of human relations. To stimulate and advance work on the prevention and control of epidemic, endemic and other diseases. WHO also proposes conventions, agreements and regulations. It makes the recommendations about international nomenclature of diseases, causes of diseases and public health practices. It also develops, establishes and promotes international standards concerning foods and biological, pharmaceutical and similar substances. Now, challenges for the future. So much of the world has been benefited from the better health in the 50 years since WHO was founded. But the need for WHO is greater than ever. Cholera and malaria were major health priorities in 1948. Unfortunately, after a period of decline, both are on the increase again and so remain a problem. There are other examples of so-called re-emerging diseases. To make matters worse, some medicines and antibiotics are becoming less effective. Now, next international organization is the Red Cross. So, Red Cross is a non-political, non-official, international humanitarian organization. It is devoted to the service of mankind in peace and war. The idea of this voluntary organization was conceived by Henry Dunant, who was appalled by the neglect of thousands of wounded and dying soldiers in the Battle of Solferino in 1859. Dunant's plea met with success in 1864 when, in the First Geneva Convention, a treaty was signed for the relief of the wounded and sick of the armies in the field. Thus came into being the International Committee of the Red Cross (ICRC) and independent neutral institution, the founder organization of the Red Cross. The emblem of Red Cross is a red colored cross painted on white. Now, activities of Red Cross. So, major activities of the Red Cross during war and peace are as follows. Humanitarian services to the victims of war, to extend relief and help to the victims of any natural calamity such as flood, fire, famine, earthquake, etc. To procure and supply blood to the needy victims of war and other calamities. To provide all possible first aids in any accident. To educate people in accident prevention. To arrange for ambulance service in all emergencies. To look after maternal and child care centers. The Indian Red Cross Society is also engaged in training midwives. Now, some other international organizations. So, in addition to the mentioned international organizations, some others worth mentioning here are UNICEF, that is United Nations International Children's Emergency Fund. It is the specialized agency of UNO established in 1946. It was constituted to deal with rehabilitation of children in war-ravaged countries. It works in close collaboration with WHO. Next is UNDP, that is United Nations Development Programme. Established in 1966, it is the main source of funds for technical assistance. Then FAO, Food and Agriculture Organization. It is the UNO first established agency created to look after several areas of world cooperation. Then last is ILO, International Labour Organization. It was established as an affiliate of the League of Nations to improve the working and living conditions of the working population all over the world. So, thank you.